Montgomery County Executive Marc Elrich is pushing back on the Trump administration's warning earlier this week against vaccines and using Tylenol while pregnant.
Elrich called the statements dangerous and said they may cause people to not seek out critical medical care. Our Lionel Donovan is here in the studio now with more on the county's reaction to the Trump administration's claims. So what's he saying, Lionel?
Good afternoon, Leslie. Well, today I spoke to Dr. Keisha Davis, a family physician who's echoed Executive Elrich's concerns. She pointed out that so many conflicting narratives around healthcare just adds pressure on parents when they're trying to make the best choices to protect their children. Earlier this week, President Donald Trump issued a bold warning to the country.
Don't take Tylenol.
President Trump and Health and Human Services Secretary Robert F. Kennedy Jr. announced on Monday that the over-the-counter medication, whose primary ingredient is acetaminophen, has been linked to an increased risk of autism in children. However, family physician Dr. Keisha Davis says that claim isn't backed by science.
There has been some recent studies that have raised questions about possible associations with autism or ADHD, but association is not causation. The overall evidence remains inconclusive, and professional medical groups continue to recommend acetaminophen as the safest choice for fever or pain during pregnancy.
President Trump also questioned the safety of vaccines. Dr. Davis says while there's nothing that links vaccines to autism, Mr. Trump's comments only create anxiety for parents and make them second-guess their decisions to protect their children.
Many in the community have spent a lot of time dealing with feelings of guilt about, was there something that I could have done? Was there something that I should have done differently that caused my child to be, to have autism?
Meanwhile, Montgomery County Executive Marc Elrich said the Trump administration's statements were dangerous and their recommendations shouldn't be followed.
I'd put no stock in what's coming out of the federal government. I put my stock in health professionals.
Which is why Elrich applauded Maryland's inclusion in the Northeast Public Health Collaborative, a multi-state group that will provide guidelines separate from the federal government on public health matters. Now, Dr. Davis went on to say that while she's not aware of a strong statement that's been put out against the federal government regarding its public health guidelines, her decisions moving forward will be informed by the state's guidelines and professional medical organizations. From the studio, Lionel Donovan, WUSA 9.
Yeah, good to clear up some of that confusion.
Doctors their phones have been ringing off the hook since this happened, with people asking questions, wanting to know what to do. So to your point, Lionel, a lot of confusion out there. A lot of physicians trying to cut through the noise.
That's right.
All right, thank you.